All right, thank you. One thing Americans are greatly worried about is health care. Some members of the healthcare industry are alarmed over the $100,000 fee President Trump slapped on H1B visa applications last month. Trump said the goal was to protect American jobs and wages, but rural and medically underserved hospitals say it's going to make a shortage of specialists even worse. Joining me now is Carolyn Lundry. She's the residency program coordinator at St. Luke's Hospital. Thank you so much for being here with us from Chesterfield, Missouri. First of all, how much do you rely on foreign talent to help make sure that you have enough to staff the care for patients there?
Well, our hospital is a community hospital. We're not rural or underserved, but we are a community hospital, and we do educate and graduate residents who do take care of patients later in rural and underserved areas. Our program, which is 44 residents, is made up of approximately 90% international graduates.
Can you give me some sense of what this $100,000 fee that's slapped onto H1B visas is going to do when it comes to your program and when it comes to getting those graduates out to rural areas?
Sure. Well, for our program, our hospital, hospitals are so squeezed anyway, and being a community hospital that's not part of a large health network system, we're just an independent hospital. We would not be able to sponsor an H1B visa for $100,000, which right now is approximately $4,000. There would just be no way. So if we can't educate and graduate those residents, we can't put them out there to take care of patients later in these other areas.
Why is it so hard to find, talent inside of the country at this point?
Sure. Well, 98% of American medical graduates, those are MDs and DOs, 98% of them can find an internal medicine residency program if that's what they want. But that leaves over 5,400 positions open. So those 5,400 positions have to be filled by someone. Someone needs to take care of these patients. So we pull from the best of the best. Actually, these residents that we pull from are amazing. Everyone takes the same exams. So the scores that people get on exams can be compared and contrasted. So that is a metric that we have to use. But I mean, there's just not enough American medical graduates to fill all of the spots in residency programs.
5,000 spots, I mean, that's a lot of people. That's a lot of physicians. I was just looking at this National Institute of Health study from 2021 saying that more than 64% of international medical graduates worked in areas with physician shortages. What keeps you up at night as far as what you're going to do for patient care?
Well, that's actually a very good question because I've been doing this for 30 years. So I've made some real connections with the residents who've come through my program. And I try to, just talk to people and make them realize these are human beings attached to these numbers. They've gone through some incredible traumatic things to get to this point in their career. And to be denied that chance because of some arbitrary dollar amount, it just seems so not fair. And all we really want is a definitive answer. And obviously a physician exemption from the $100,000 fee.
Will patients suffer because of this?
Yes, if you think forward, there's going to be a shortage. I mean, if people have to wait now to see a primary care doctor, which are in short supply, it's going to be even worse.
Carolyn Lundry, thank you so much. Appreciate your time and your heart on this.